I was wiping my brow and I was like, oh, my forehead is so soft. So I'd
Hmm.
be at work just like, oh, my forehead. I love this forehead. Hello, Jay.
Hi, Skype crapped out on me.
Sad trombone.
Yeah, let's hope that doesn't happen again. You were going to tell me, I think, about your initial discussions with
Yeah,
a head shrinker.
right. So I did talk to my psychotherapist about it, and what she mentioned to me was that, well, she was comfortable treating me for ADD and so on, but that she didn't have expertise in the area of gender
Huh,
stuff.
okay.
So she recommended that I go see someone who specialized in
Ah,
that kind of thing. So she was curious to learn about it and be supportive, but she didn't have a lot of experience
yeah.
helping people in that area.
Hmm.
So I asked if there was anyone that she would recommend that I talk to, and she said, well, I think I was her first transgender patient.
Wow.
So she had some medical, local medical directory kind of thing. And I think it may have been, I think it was an online reference that she had access to. And so she sent me a few names, but she hadn't worked with any of these people before.
Oh,
So
okay.
it was kind of just to offer me a starting point, but there wasn't really,
Yeah. Which of these
she,
names look visually appealing to you?
something like that.
Yeah.
So I didn't know who to talk with, but
When I went in for a particular procedure, there were review websites where they compared doctors and offered.
right,
Is there anything like
yeah.
that? Given your penchant
Um,
for researching?
well, I tried Googling and such, but I guess when it's your head that it's hard to objectively judge what success means
Ah,
sometimes.
okay.
Just since if you broke your arm and you go to a doctor and he fixes it, or if she fixes it, then okay, you're a good doctor, or at least someone who's
Right.
competent.
Yeah, yeah. Okay, fair enough.
So as it would happen, I thought back to when I called the local LGBT resource center in the area.
Oh, yeah. We
Yeah,
talked about that in episode 1, I think.
right,
Okay.
right. And so that was sort of one of my first avenues after coming out to me to figure out what I would do. And among other things that I talked with, I thought there was probably someone I should go, a counselor type person I should see. I kind of knew that much at the time. And so I asked her, well, do you have any recommendations?
Yeah.
And she said, well, I've heard a lot of good things about Felicia.
Okay.
And he gave me her website and
Mm-hmm.
address and everything. This was a sample size of one, as you might say.
Right.
And she seemed like a perfectly nice person, but at the time I was kind of hoping for additional recommendations that might come across and what have you. That was like June-ish or so of 2010 when I talked with the resource center people. And then I talked with my psychotherapist, I think it was in September, late August, early September.
Okay.
And so she gave me that list. And to make a long story short, I, for lack of other leads, that I didn't really find much online as far as recommendations. I mean, certainly there were such and such counselor person and so on, but there weren't a lot of third-party reviews of counselor people.
Generally speaking, I don't know that we've gone over this. What is the overall percentage in America of transgender folks?
From the statistics I've read, it's somewhere between 0.5% and 1%.
Okay. So that might explain why the market for a support system is not larger.
Yeah, and that's fair enough.
Still frustrating, though.
Yeah, so I got sort of that list of a few names from my psychotherapist, and then had also this idea about Felicia. And so it happened that she was on this short list from my psychotherapist. So I thought, well, she looked friendly on her website,
Mm-hmm.
and I gave her a call. So I set up a session with her.
Okay.
And
You paying for all this out of pocket?
oh yeah,
Yeah. Okay.
yeah, since trans people are largely ignored by the insurance
Right.
people. So I met with Felicia. She turned out to be very, very nice. And she was also very caring, which I mean, you would expect, of course. But for example, she mentioned during our first kind of session, here's my normal rate. Is that something you can afford?
Hmm.
Because if it's not, we can adjust it. Because what was more important to her was that people who needed to talk to a counselor could do so rather than just profit.
Okay. In your discussions with Felicia and the help center,
Right.
had anybody expressed a concern about like a worst case scenario if you're not able to get the advice slash support slash help that you need, you might consider killing yourself?
I had not heard that from.
Well, and I don't mean to put thoughts in your head either.
No. I had not heard that specifically from them, but I would imagine that they would likely have training to look out for signs of that
Okay, fair enough.
kind of thing. I've read a survey of transgender persons,
Mm.
and my understanding is that of those who not just contemplate suicide, but those who attempt suicide
Mm-hmm.
is 40%.
That's pretty high.
Yeah.
Is that among people who are simply suffering from gender identity disorder, if I'm using the right term, or people who start on the path as you have, or both?
I believe that's the larger umbrella, as it were,
Mm-hmm.
just since, as you might imagine, for some people, perhaps they are unable to transition due to restrictions of family or work,
Mm-hmm.
and that might lead them down that path.
Right.
So, as this affects me, what I'll do is I'm going to tell the end of this anecdote first, or this point of view, and then I'll tell the beginning and then the middle, and you'll see why.
All right.
So the end of it is that, well, none of that's true, so therefore I'm going to be around for a long time.
Mm-hmm.
I have thought, though, that if hypothetically reincarnation were 100% true, and if it were scientifically verifiable, then I would probably kill myself. But, as I mentioned, neither of those things are true.
Right.
And so I'm going to be around for a long, long time.
Yeah, that is perfectly logical and horrifying,
Yeah,
but with a happy ending.
I hope so. Yeah.
Mm-hmm.
Yeah.
So tell me about your first visit with Felicia after you guys negotiated a rate.
Right. So a lot of what we talked about was she wanted to see where my head was, I suppose. Just since some transgender people are, they might be questioning their gender, or some people may be completely certain about it. And so I guess as kind of a setup for future sessions, those depended on where I was. I mean, a lot of this was about what we had talked about in the first episode. So things like if this had been something I thought about recently, or if it had been something I had been thinking about for a long time. We talked about what puberty was like for me. We talked about if I ever imagined myself as as a woman. And so it was kind of an exploratory thing, and we talked some about how I came to come out to me, that kind of thing. So it was really useful, I suppose,
Okay.
just since a lot of those types of things I had internalized, but I hadn't. I mean, I knew where I started and where I ended up, but I hadn't kept a mental log of all the interim steps. So just kind of talking through those helped me get my head around some things.
Excellent. How regularly do you guys talk?
At first, we would see each other every 2 weeks, about.
Okay.
As I mentioned, it was helpful to me in the sense that I could vocalize some of what had been just internalized for me. And then as well, when it was approaching Thanksgiving and I had wanted to come out to my parents, it was helpful to be able to kind of think through those types of scenarios and how that might go. So it was really helpful to me. Yeah.
Is this somebody that you go to just to talk about stuff, or are you getting prescriptions as well? The same place?
Felicia is a licensed counselor, but she does not have a medical degree. So
okay, right.
Per the something standards of care, they recommend that you have, I believe, 3 months counseling before starting HRT.
All right. So for the ignorant in the audience, what is HRT?
HRT is hormone replacement therapy. That would be estrogen and testosterone suppressors for male to female transgender persons, or for persons who are female to male, testosterone injections.
Do you want to tell me about how you came to the idea that HRT was an option for you and how you went about starting it?
Yeah, so...
Is this something that was in the FAQ that you read when you were 13? Hormone replacement therapy?
Yes, it is.
Okay.
Yeah. So
you'd known about it for a good long time.
Right. So just to kind of summarize some of that earlier episode, for if people hadn't seen that one yet, I had read a FAQ online in the, I guess, early 90s about transgender topics, and it was listed there. So yeah, I was familiar with it existing, I guess. I suppose that as I was seeing Felicia, I mean, it occurred to me that HRT could be an option for me at some point. And what held me back for a ways was just, I figured my parents would want nothing to do with that. This is in the summer of 2010 or so come more or less current-ish day. But I was reading more about hormone replacement therapy, and up until then, I mean, I knew that it existed, but I didn't know the specifics of how it worked.
Okay.
And so for male to female transgender persons, there are actually 2 medications. There's a synthetic estrogen, and then also a testosterone blocker. And the latter, which is spironolactone, is necessary just in the sense that, as I've heard it described, testosterone is sort of the alpha hormone. And so if you have testosterone in your system, it'll kind of stomp on the estrogen.
Oh, okay.
So the testosterone blockers are necessary to bring those levels down so that the estrogen you're taking could have any effect.
Okay.
So, incidentally, that's also why for female to male trans men, they only need to take testosterone.
Right.
Because that will stop on the estrogen they would have had. So I was reading about these 2 things, and, well, I came to realize that most of the time they're taken together to kind of work together. In some cases, though, even reducing one's testosterone would have its own set of effects, and then adding the estrogen has its own set of effects, so they
Mm-hmm.
kind of work together in that regard. As you might expect, the lack of testosterone generally reduces one's male characteristics, while the addition of estrogen increases one's female characteristics.
Right.
So theoretically, you could take just a testosterone blocker and become more androgynous without specifically becoming more female.
Interesting. Okay.
So at the time, I found this intriguing just since I thought, well, maybe this is some way that I could feel like I was being more true to myself without making my parents angry or what have you. Since I would appear less male, but not necessarily specifically female.
Oh, okay. If you were just to do the testosterone blocker.
Right.
Okay.
Right. So I had this in my head, and then I think I had read about that around about the time I started seeing Felicia. And as I talked with Felicia more, it kind of brought up a lot of feelings about things that I had in my head, but just that I hadn't vocalized before. And I really came to realize that, at least for me, if I was gonna go down this road, I didn't want to do it halfway.
Okay.
I guess.
Was it that same sort of, would I be annoyed with myself 10 years from now if I only became androgynous instead of becoming a girl?
Yeah, I think yeah, that was basically what it came to. And so, well, part of what also played into it was that I felt that I didn't want to be known by my birth name for the rest of my life.
Okay.
And so even that alone meant that I'd have to talk to my parents sometime.
Yeah.
And so, well, if I'm going to have an uncomfortable conversation with my parents, I may as well.
And you'd already had one, or this was before Thanksgiving.
Right.
Okay.
Yes.
I'm sorry.
Yes. So after I'd been seeing Felicia for several months, I think she asked me a question like, so do you have thoughts on where you want to go from here? Something like that. And so I said to her, well, I might be ready to start HRT. And so she had a list prepared of several doctors in the area that I could see about that. And what was nice is that these were, I don't know, pre-screened, if you will. Of course, one can see an endocrinologist for this kind of thing, which specializes in this field, or one can also see a more generalized physician who also has expertise in this area, but is not necessarily as a specialty. The only reason I mention that is just that one could theoretically go to your regular checkup physician doctor and have HRT prescribed. But
it's good to know.
As you might expect, not all doctors are tolerant people, just like not all people are tolerant people.
Sure, yeah.
So all these doctors were known to be trans friendly.
Okay.
You would still have to meet the qualifications, as it were, as being healthy enough to start HRT and things like that.
What are some things that might disqualify you?
I think like high blood pressure might be one. I think people who smoke might be discouraged.
Interesting.
And I think some of this is just a way that HRT can have a small effect on one's sort of circulatory, respiratory system, just because there's some changes there.
Okay.
So just kind of an extra cautionary thing in those cases. But for me, I don't smoke, and my blood pressure is normal and so on. So, but at any rate, so I picked out a doctor from the list. I mean, Felicia kind of walked there. I think maybe 4 or 5 of them. She went through each one, kind of giving me a mini bio, and picked out Dr. Wright. And she sounded like a friendly, qualified person. So yeah, I had my appointment, and this was, I guess, late November of 2010. And they did take uh, a blood test on that first appointment, if I recall, uh, just to make sure that sort of my cholesterol and all those kinds of things were within normal ranges.
Okay.
And also just to see what my testosterone levels were at the time and estrogen levels were at the time.
Right.
Just naturally occurring estrogen, so that on future visits they could compare and see how I was progressing.
Okay, sure.
I believe my first dose of HRT I took on the Wednesday before Thanksgiving of 2010.
What happened?
Well, it was, I don't mean to be dramatic about it, but it was sort of like Morpheus had handed me the red pill or something.
Yeah.
I mean, obviously, or I shouldn't say that. It may not be obvious, but HRT takes kind of a ways to have an effect. In part because it takes a few weeks for one's testosterone to fall low enough for the estrogen to have any effect.
Okay.
I can remember having the various tablets in my hand and gulp and then glass of water.
Yeah.
But of course, I mean, the next day I felt the same.
Right.
But I knew that, well, 4 or 5 weeks from now, maybe things will start happening.
Similar to the time when you came out to your friends and whatnot, did you prepare them for whatever was going to happen as a result of the HRT?
Yes. I sent out an email to my closest friends in Dallas. I mean, I'd come out to many of them already, but I told them I was transgender. I told them I picked out a name, Ashley, that I would like to call me. And I also gave them several links on what the expected effects were of HRT, which I had started.
Okay.
So one of them was to just Wikipedia, and one of them was from another website.
The new Usenet.
You could say that. Sure, but yeah, with less spam.
And so since then, what have you noticed? Has the HRT worked as promised?
Well, that's sort of the tricky part, which is to say that it's sort of like going through puberty again. From start to finish, it could be a year or two. It's not a quick thing.
I didn't realize there actually was a finish.
It's not so much a finish, but a diminishing returns, as it were.
Okay. But your body isn't at some point going to start re-educating itself about producing more estrogen than it used to the first 30 years or so?
No, I will have to take estrogen for the rest of my life.
Okay.
Yeah. And the testosterone blockers, I may or may not have to, depending on what surgeries I may have.
All right.
The other aspect, in addition to just the timing of it, is that much like regular puberty, it affects everyone somewhat differently.
Okay.
It's just all genetics, or a lot of it's genetics.
Yeah.
So some people go through it more quickly than others. Some people have bigger this or smaller this. And so in that respect, it's just sort of luck of the draw genetically.
So if you're undergoing therapy I guess if you're undergoing a drug therapy to grow breasts where you normally had none, you might get an idea of how big they would be by looking at the women in your family.
Exactly.
Okay.
Exactly. So sort of the rule of thumb is that if you look to your nearest female relative, so your mom or sister,
right,
you could take her cup size and reduce it by 1. And that's sort of a ballpark area, I guess.
Okay.
It so happens that my mom is fairly petite, so I was not getting my hopes up.
Sure, fair enough.
Yeah.
What are the other effects of HRT?
I suppose in some ways it's almost easier to talk about what doesn't change.
Okay.
Namely, two things, one of which my skeletal structure does not change,
Right.
which seems obvious, but for instance,
Well, there's the
my
whole
my
hip bone thing.
right, there's the hip bone thing. There's my size fucking 13 feet.
Oh.
Well, it's size
Are they really
13
13?
women's, which is 10 and a half men's. And the other thing that does not change for male to female transgender persons is the pitch of one's voice. So I am stuck with this stupid voice.
Um,
Although there is some training one can undergo
I
to
was gonna say
somewhat
that's.
alleviate that.
I don't know who to use as an example, but like, who knows what RuPaul really sounds like? But when you listen to RuPaul, it sounds just like a woman, right?
Indeed. Yes,
So
although
have you thought about faking it and then just getting in the habit, and then maybe after a while you wouldn't really feel like you're faking it anymore?
that is easier said than done.
I didn't say it would be easy.
Right. Just as kind of a minor asterisk, of course, RuPaul is a drag queen,
Hmm.
and in his day-to-day life, he's a gay man, but he's not transgender.
Okay.
Anyway, so yeah, I could fake it, as you say, but what I've come to learn is that there's a lot that goes into a voice, which probably sounds obvious, but in addition to a lower pitch in a typical male voice, there's also more resonance, for example.
Okay.
So simply raising the pitch of one's voice is not the only thing to it, I suppose.
Sure.
As well, it's quite easy to overcompensate and end up with sort of a Mickey Mouse kind of sound, which does not work at all.
No.
So it's a very nuanced thing, and on top of that, women also have different speaking patterns. They have different. Oftentimes, they'll use more adjectives to describe things, or different adjectives, or
Okay.
they will have almost a musicality to their voice.
Taking all that as a given, that doesn't necessarily mean it's not worth trying.
No, I agree. But I would probably at some point see a speech therapist
Hmm.
for this rather than trying to guess.
Sure. That makes sense.
Just since it's
You do have this habit of doing things correctly.
so. I mean, it's not just it's not just the pitch and things, but I would want to get the whole package as much as I could.
Sure.
Just as you might imagine, even if you think of those different facets, if supposing one falls short, if you get the other one spot on, like if your pitch isn't quite right, but you get the right intonation, that kind of altogether might work.
Yeah, because
But
if you're at a baseline now, let's call it 0%.
sure.
I have to imagine you'd be a little bit happier if you'd only got 50% versus 100%.
I would probably be somewhat happier. The issue is that society tends to make a very binary decision about the gender of people they interact with.
Mm.
And so if I'm say at the checkout at the supermarket or whatever, and they ask, would you like debit or credit or whatever questions they have,
Right.
I may be 70% there, but it comes down to that tipping point that if I'm 70% there, but it doesn't pass, then I would fall back into the other bucket just because most of society doesn't see people as an interim bucket.
Well, you've had some successes lately, I've noticed on Twitter, where people are calling you ma'am.
Yeah. And
think-
that is fantastic.
Right. I'm assuming this was before you spoke. They would call you ma'am? Or has it gone both ways?
Both of them happened to be before I spoke.
And then they didn't make weird face after you did start speaking.
No.
Okay. That's good news.
Right. Right.
Well,
So,
just for selfish reasons, I would like you to try, even if it's just in private, and see if you could make yourself feel happier by
yes,
playing
yes.
around.
I mean, believe me, that is something on my list, but
Okay.
I, I suppose part of it is just that once again, it's not covered by insurance, so
Mm.
I mean, I don't know what, I'm just kind of guessing here, but maybe it's 60, $70 an hour for this.
Speech therapy?
Yeah,
That
I
sounds
don't know.
reasonable. Yeah, I was gonna say maybe 75.
Okay, well, okay, sure, 75, but suppose I go every week for a couple months. I mean, it's not cheap. It's not to say it's not something I want to do, but it's because I'm kind of dealing with other things for the time being.
Okay.
But yeah,
All right.
yeah. So those are the two things that don't change:
Okay.
the skeletal structure and one's voice. As far as other things that changed, you mentioned breast growth, and
Mm-hmm.
that's one of them. And additionally, there is the addition of subcutaneous fat, which sounds kind of fancy and all, but all it is just fat that grows underneath one's skin. And so it is this thin layer of fat which
Yeah.
makes women's skin softer. For instance, on
Oh.
their arms or on their shoulders or back or wherever.
Okay.
So that's something that comes in.
Fun. All right.
Well, and this might sound stupid, but it was kind of magic when that was happening for me.
Mm.
Because like it'd just be the stupidest thing. Because like I noticed like my shoulder. It's like, oh, that doesn't feel like the old shoulder I used to have. It's like a
Yeah.
softer. It's a girl's shoulder.
That's
And so I
awesome.
just feel like at work, typey, and I just like, I love this shoulder, because I was, and then, like one day I noticed, like, I was wiping my brow, and I was like, oh, my forehead is so soft. So I'd
Hmm.
be at work just like, oh, my forehead, I love this forehead.
That's fantastic.
It's little things, but
Yeah.
so yeah, that's been something that's been working a bit for me. It's not, I don't think I'm done in that regard, but
Is body hair growing at a different rate?
as far as the things that don't change list or whatever,
Hmm.
one's facial hair is not affected by HRT,
Ah, damn.
at least for male to female
Okay.
transgender people. For female to male, facial hair is put out,
Interesting.
uh, but that's one that annoyed me much less because you can get laser hair removal or electrolysis. And so, in fact, I have had laser hair removal in my facial hair. So
That's less expensive than speech therapy?
it is not a cheap item,
Yeah.
but it is not as stressful as speech therapy
Oh.
because with laser hair removal, you've got a pretty good chance of success. I mean, they run the machine over it and
Yeah.
there's several sessions, but
Because I've thought about
voila.
that for myself. Shaving is a pain in the butt.
Yeah. Oh, I can totally recommend it.
Okay, good.
Yeah. So anyway, yeah, because I mean that's guaranteed. But with, I guess, just not to get hung up on the speech thing, but that's something that
Yeah.
part of why I might be procrastinating is just that I mean, there's no guarantee of success there. I could falter for months at a time, um, and as well, it could be embarrassing in some ways to try to pass with my voice and not, I
Hmm.
suppose.
I don't know. From where I'm standing, it seems inevitable.
Inevitable that I would uh have speech therapy or
Go
that I would get it to the point where I could pass.
both.
Well, I appreciate
I, I,
your
I
vote of
also
confidence.
probably think it's inevitable that you might fail on occasion, but
Well, thanks. Even though
not
that's likely
because
true, but
not
yeah.
because I don't have faith in you, but because people fail on
Right.
occasion. You know.
I mean, you can think of it like when you're in high school and you want to ask a girl or a boy out,
Mm-hmm.
and inevitably you're gonna fail, but that fear of rejection, that really sucks.
Yeah.
You know? And what I've heard from many trans women is that talking over the phone is one of the hardest parts.
Mm-hmm.
Just since when people assess gender, it's sort of a split second thing for the most part. And it's based on all of the factors as far as your attire, your face, your torso, and voice, and all together. Over the phone, on the other hand, it's only your voice that is coming through. And so for many trans women, they may have a voice that's kind of on the borderline and works just completely fine in day-to-day life. But over the phone, they might not pass.
Mm-hmm.
So
I have to cut you off on
Okay.
that, but we will certainly come back to drugs and hardware.
Sure,
Because there's a lot more to talk about. But in the meantime, could you teach me something girly?
I can do that.
Good.
Yeah. So I have 2 eyeliners.
Eyeliner.
And this first one,
That's a pencil, right?
well, it can
It
be a
used to be.
pencil.
It was a pencil when my mom put it on.
Well, and it can still be a pencil.
Okay.
Eyeliner really is just, it describes more so the location of what you're applying
All right.
and so on, rather than
Remind
the
me where
exact
that is.
tool. But I mean, it's just it's the tip of one's eyelid, the edge.
Oh,
So,
okay.
you know,
I was going to guess wrong.
and you can apply it on the top or the bottom or both.
Oh, okay.
In my case, I usually just do the top lid, just since I haven't quite got the hang of the bottom lid part yet. But anyway, so yeah, pencils, totally valid eyeliner. And there are also other options. So this first one is ostensibly my favorite. And what are you grimacing for?
That's not how I would use ostensibly. But I'm really curious to see what you mean.
Okay. So this is from Maybelline, and it's called Lion Stiletto.
Okay.
And
Lion or Line?
Line.
Okay.
Lion Stiletto. Even though Lion would be kind of cool just from a nerd point of view,
I'd
but
love to see a lion in stilettos.
it could be a good True Bullet episode. So, I'll see if I can get this on camera. But what's nice about this one is that it has, I guess, this part is sort of the ink well, as it were. It's not literally ink, but whatever the
Space
bits
age
are.
substance.
But
Yeah.
so it's got this sort of pointed tip, and it's made of basically what looks to be felt, so it's flexible. I don't know if you
okay.
can see that there.
I sure can.
But it makes it very easy to apply to one's eyelid, since you have more leeway in terms of how much eyeliner you want at a time, sort of the surface area of the tip and how much of that is going onto your eyelid.
Okay.
And so it works fantastically. And so you were asking, well, why would you say ostensibly?
Right.
So it so happens that this particular eyeliner does not agree very well with my contacts.
Oh.
That invariably with eyeliner, you usually get a minute amount in your eye, which, I mean, it's designed to be completely harmless. That's designed to be an okay scenario.
Mm-hmm.
I mean, it's not made of poison or anything.
Right.
But at the same time, for me, and this is different for people who maybe don't wear contacts, or for people who wear different types of contacts, but for me, sometimes the little bits would kind of get underneath my contact and irritate it.
Okay.
So,
hey, I just had a brainwave.
Okay.
You could wear girly glasses.
Well, so yeah, that's like a whole other thing,
Yeah.
and that is something which actually I am considering.
Okay. Good.
So I'll try to make this part really brief, but I have thought about getting girly glasses. But what I realize is that glasses are something, unlike, say, your shirt or your shoes, that you have every day.
Yep.
And so you don't want to screw it up as far
Yeah.
as like getting a style that doesn't fit your face or whatever. So what I would love is to be able to like hire a fashion person or
Personal
whatever.
shopper. Yeah.
Yeah. To go with me to the glasses store or whatever. Maybe I would offer some ideas, but maybe he or she would say, you should try this one, or just because that would be awesome. You'd think there'd be some service for that, so that, you know, because you don't want to fuck up your glasses.
No.
So anyway, yeah, that's something I've thought about.
Okay.
And then I
good.
could use this eyeliner again.
Yes.
So
Ostensibly.
I've given one of these to my hairstylist. Not one that I've opened, just doing the package. I mean, she loves it. So I'd recommend it to anyone. And if it so happens that your eyes don't agree with it, then
give it to your
switch to
hairstylist.
something else. So the other product is this jobby, which is also an eyeliner. And this one
looks like a rocket.
Yeah, kinda, I guess. This one's from Almay. And if I just unscrew this here, you can see that it's got a tip to it. I don't know if that's showing up. And then so the reservoir jobby. Almay in general is known for offering what they call hypoallergenic products that are specifically designed not to aggravate allergies or things like that. Almay offers a couple different eyeliners, and one of them said something like, can be used if you wear contact lenses or something. This one said, good for persons with contact lenses. So I was like, hey, that'll work for me. And indeed, it doesn't irritate my eyes at all. And it offers good coverage and so on. One, I suppose, downside is that the tip of this is not flexible like it is on the line stiletto.
Yeah, okay.
So it takes a bit more nuance to apply well. But given that I don't want my eyes to be all jibbly jobbly, I figure I would go with this one.
Okay.
So, and both of these are available at drugstores. So I think I've got both of them at Target or CVS or something, but I don't know, like $5 or $6 each. They might be slightly more, but not terribly expensive. And yeah, so I mean, if anything, I would totally recommend this line stiletto. But if it doesn't work for you, then this Almay one is probably a pretty good bet too.
And is that something that comes in different colors, or is it just kind of dark?
Well, so I have green or hazel eyes or something like that. So there's all kinds of like color theory stuff about like if you have green eyes, you should wear this color eyeliner and such. So indeed, probably the most common colors are brown, black, and then many brands often have what they call blackest black, which is kind of stupid, but essentially my understanding is that the black one is sort of a dark charcoal, and blackest black is just like fully black. But from what I understand, brown often works best for green eyes, so that's what I've gone with.
Okay.
And in fact, one thing that's also very handy that some brands are doing now is they'll have, I guess, the racks of the various products. And right on the package, they'll be kind of grouped into like eyeliner for green eyes, eyeliner for blue eyes. And so you don't have to guess anymore. You're just like, oh, I have green eyes. I want this one.
Yeah.
So
that's good that they're doing that.
Yeah, super handy. So yeah, I'm pleased with both the products, but all things being equal, I'd probably go with the Maybelline line stiletto. And if you have any ideas on the glasses thing, or how I can go about finding some that are fashionable,
I always recommend whatever Lisa Loeb is wearing.
Oh.
Yeah, they are 5 times sexy. That's just one man's opinion, but it is coming from a man who thinks that more women should be wearing glasses.
I would concur with that opinion.
Okay.
Although I'm not a man, but...
Right. Well, that's all great. I'm really looking forward to next time. Thank you for joining us this evening.
Oh, it's my pleasure, Jay.
Good night, sweetie.
Bye.